Welcome to the ResMed's Centres for Healthy Sleep at London and Abingdon. At both of our clinics, you can be assured of a warm welcome, where you'll be treated by one of our first-class sleep specialists. Our Centres for Healthy Sleep in London and Abingdon provide diagnosis and treatment of sleep-disordered breathing, of which the most common form is obstructive sleep apnea, or OSA. Our centres have offered the highest standards of sleep disorder advice and care since 2004 and are a regular port of call for patients long established on treatment.
The London Centre for Healthy Sleep is based in the heart of London, next to Harley Street. We see patients for screening, diagnostics, treatment, annual review services for patients who suffer sleep disorder breathing conditions.
We employ only UK registered practitioners with experience in sleep medicine to ensure the very best support for our patients. Long-term relationships are important to us. Many of our patients started their treatment journey years ago and continue to visit annually for review. At ResMed, we are a truly global business with operations in 70 countries. We're highly regarded for our individual service by healthcare professionals and patients alike.
At the clinic, we perform a range of diagnostic and screening tests, as well as we set patients up with CPAP therapy, and we also perform their follow-up care and annual reviews.
We have a full screening and diagnostics program for new sufferers and provide friendly and caring advice for these patients.
So the screening and diagnostic process that we offer, the patients have the choice of whether they would like just a screening tool, which will give them an indication if they're at risk of sleep disordered breathing, whereas the diagnostic service that we offer, they can actually get a diagnosis from that, and then if they require CPAP therapy, they can either come back to our clinic, or if they decide they may opt to go into the NHS to get their treatment.
We also run diagnostics here from the London Centre. We receive referrals from sleep physicians, GPs, respiratory consultants, ENT surgeons, cardiologists. Those are the main groups of consultants that we receive referrals from for patients who they suspect may have a sleep disorder breathing condition. So I see the patient for about 30 minutes in a consultation to understand their past medical history and understand their symptoms. And then I program a small device known as a NOx T3, which is one of the latest innovations in home sleep testing. The patient doesn't need to press any buttons at home at night, but I do show them the setup in the clinic, make sure that they're clear and they understand the setup and they're comfortable with it when they take it home that night. And then the following morning, they drop it back to me, and I just need about 5 minutes with them so that I can understand so that I can read the integrity of the data. And if it's good on which to base the diagnosis, then I continue with the analysis. And then I send that analysis to a sleep physician, and that sleep physician makes a diagnosis based on that data. And then the patient will come back to us for treatment, if needed.
Whether you've been diagnosed by one of our own clinicians or referred to us by a private sleep specialist, our own specialists are here to provide you with everything you require for your treatment and comfort.
So once a patient's had a UK sleep study and they've got their diagnosis, they can then come to one of our treatment centres. We have one in Abingdon and one in London, and they can get set up with CPAP therapy. When they come in for their appointment, we'll go through education, make sure that they're aware of what causes sleep apnea, we'll go through symptoms and signs, and then we'll also talk through the treatment with them.
At ResMed, we understand that getting used to your therapy and getting the most from your equipment is paramount to your health and well-being, which is why we place as much importance on your follow-up appointment as we do on your setup.
So once the patient's fitted comfortably with their mask and they're aware of how to read their sleep report and are happy with the setup of the device, I'll ensure they have our contact details, and I'll give them a call within the first couple of days of their treatment to see how they're getting on. Okay, so there is ongoing support from our clinicians both at London and Abingdon centres. We also have a customer service advice team based in our Abingdon centre in Oxfordshire. So the patient will also get another call a week later, And again, it's just a touch-base call just to make sure that they're getting on okay. They can of course call or email anytime. Okay, it's really important in the first few weeks that they do get the support and follow-up that they require. So we invite all patients back to our centre after a 4-week period so that we can actually review their data together and ensure that the settings are comfortable for them. We can make any alterations then or of course beforehand as well. And we have the benefit with the current AirSense 10 device to do this remotely, especially with the remote assistance that we have integrated within that device. So it's very easy.
As well as screening, diagnosis and treatment setup, we also offer a wide range of masks and advice on how to get the most from them.
So ResMed do a variety of different masks, but it's really important that the patient fits them correctly. Often patients will over tighten the masks, and the problem is most of the masks are dual layered. So if they're over tightened, the cushion can't inflate properly, therefore they're more likely to get leaks. Also, it's really important that the patient washes their mask cushion every day, and we recommend green washing up liquid and water, and that gets the grease and oil out of the mask.
So whether you're already diagnosed with OSA and need a follow-up, or if you've been referred to us by your GP, you can rest assured that you'll be in safe hands at our Centres for Healthy Sleep.
Do you know what I absolutely love about being a sleep nurse here is the 4-week reviews after the patients have started on their treatment. They come back and many of them are very different to when I very first saw the tired souls that came in through the door 4 weeks previously. So they're full of energy, they're able to sleep in the same bed with their partner. This has huge implications for their relationships, their working life, their home life, and so many other things. So it's immensely rewarding to see patients come back actually just telling me how well their treatment's gone and how it's changed their lives.